Hello, and welcome to Introduction to Health Information Resources for Medicine. My name is Andrew McClellan. I'm the Head of Collections and Technical Services at the Health Sciences Library at McMaster University. This video will provide an overview of the services and resources available through the Health Sciences Library. We will begin by navigating to the Undergraduate Medicine LibGuide from the Health Sciences Library homepage. On the Guides and Tutorial tab, select Explore. Scroll down to Medicine Undergraduate. This guide is organized according to the curriculum. There are sections in support of pre-clerkship foundations, anatomy and physiology, clinical skills, clerkship, evidence-based medicine, and research support. We will first look at the Core Resources page. This page contains a section on quick lookup resources. The Merck manual is handy when you need to check a lab value or if you just want an authoritative introduction to a topic. Below Quick Lookup, you will find examples of popular textbooks and ebook packages containing key medical titles. The most popular packages are Access Medicine and Clinical Key. Access Medicine contains approximately 80 books along with cases, videos, and multimedia. In it, you will find Harrison's, Goodman and Gilman's Pharmacological Basis of Therapeutics, the Lang series on current medical diagnosis and treatment, Hearst the Heart, and many others. Clinical Key contains over 1,000 health-related books as well as journal articles, guidelines, and patient care material. When searching, you may wish to limit your results to books to reduce the number of results. It is worth mentioning that the library contains a wide number of books beyond what is listed in the guide. You may search these titles using the catalog search box on the home page. Your search term will pick up book title or chapter title, but it should be noted that it does not search across full text. Only searching from within the book platform enables you to search across the full text of a book. You may search for journal articles using the catalog, or you may wish to search journal titles in our eJournal portal. A third way to locate journal articles is to search databases. The library has created several tutorials on database searching, and these are available from the Guides and Tutorials section of the website. When searching databases, such as McMaster's instance of PubMed, you will see links to our subscriptions within the search results. The Get It link provides full text. Going back now to the Medicine Guide, below Core Resources is a page designed to support students from a non-science background. These resources and chapters were selected by faculty in MD Student Affairs. The next sections of the guide focus on medical foundations. The content of these pages was recommended by students in previous years. If you wish to recommend a resource, you are welcome to contact Andrea. Our anatomy and physiology resources support and enhance the educational materials generated in-house by our anatomy department. Team Med1 Education contains many anatomy and physiology atlases, including the popular Gilroy. One newer resource that was selected by students last year is Visible Body, which is also available as an app. Moving to the clinical skills page, I would like to draw your attention to Bates' Visual Guide to the Physical Examination and the Rational Clinical Examination, which may be found in JAMA Evidence. From the Drugs and Natural Products page, you will find RxTX, which contains the Canadian CPS, plus Micromedics and Natural Medicines. All three resources are evidence-based, and you can learn more about their features from the Drug and Natural Products video linked to from this guide. The Clerkship page shifts our focus notably toward patient care. At the top, you will find evidence-based point-of-care tools like BMJ Best Practice, Dynamed, and UpToDate. Please note that our subscription to UpToDate only allows for on-campus access. This Dynamed example illustrates the type of content you can expect to find in an evidence-based patient care tool. When using any tool for patient care, pay particular attention to the last updated date and the authority of the author. When you examine the recommendations in this entry, you see inline references to resource material. Other hallmark features of evidence-based resources is the grading of evidence assigned to each recommendation. For example, Level A. You can learn more about evidence-based medicine and quality grading through JAMA Evidence. One last point I would like to mention before moving on relates to framing your patient care question. PICO is a framework used to develop quantitative questions for research projects or for searching topics in point-of-care resources. The example before you illustrates how a question may be broken down into searchable components. Returning once again to the Clerkship page, you will find a link to our mobile apps guide below point-of-care resources. All resources with mobile apps are available from this guide. Moving on to diagnosis, you will find a section dealing with diagnostic tests. This information is also embedded in point-of-care tools like BMJ Best Practice, DynaMed, and UpToDate. I would like to draw your attention to our differential diagnostic tool, Isabel. A link to Isabel is also available from within DynaMed. And lastly, for Clerkship, you will find a list of specialized resources at the bottom of the page. Team of Neurosurgery and Plastic Surgery are premier resources in those specialties and are designed for residency, but they will be of interest to some students. During Clerkship and leading into your LMCC exams, you may be interested in the LMCC prep page, the cases page, and landmark papers. All of these pages seem immensely popular and are heavily used. Turning our attention to your research interests and needs, please be aware that the librarians at the Health Sciences Library provide research consult supports for your database searching. A link to the consult booking form may be found from the research support page of this guide or from the library homepage. For those interested in publishing, the library maintains a fellowship status for BMJ case reports, which grants our faculty and students a waiver on author fees. To request the code, please contact the Health Sciences Library Collection Team or Andrea. A final note related to resources is the proxy URL. The proxy URL page provides instruction on how to add the proxy to any resource link that you may have. This will enable you to log in to subscribe resources using any link. Near the bottom of this guide, you will find a link to the Student Wellness Guide, which was created by McMaster medical students. If you wish to add resources or edit this section, I am happy to make those changes on your behalf. Please contact Andrea. Should you require general help, please contact our Information Services Desk. And if you encounter access issues with our resources, please feel free to reach out to Andrea directly to expedite a resolution. And to recommend a new resource, please contact Andrea. Good luck with your studies, and please do not hesitate to reach out if you need support.